So the MINDACT trial that was, published 2 years ago. So it's sort of, I don't want to say it's old news, but I think that it's good news because that trial incorporated patients that had up to 3 positive nodes. And so almost always, in the past, if a patient had a positive node, it was almost a certainty that they were going to get, have the recommendation to receive chemotherapy. And so the fact that in the MINDACT trial, 48% of the patients that were clinically high risk but genomically low risk were, they were 48% of the patients that were in this randomized group were node positive. We can identify that there's a subset of patients that have, genomically low risk disease that may not benefit from chemotherapy. It also shows that, that there are tumors that are higher grade that may have a more indolent biology, maybe because they're very strongly estrogen receptor positive. And so I think the fact that, the MammaPrint, looks at, 70 genes and looks at, tumors in many different ways, it may give us some greater insight into the biology of the cancer. And so in that group of discordant group that were clinically high risk and MammaPrint low risk, patients without chemotherapy that didn't receive chemotherapy at 5 years had almost a 95% chance of being alive and free of distant metastasis. And so, and again, I presented earlier in my talk that the benefits of chemotherapy are often seen and enjoyed within the first 5 years. And so even though the TAILORx trial had 9 years of follow-up and the MINDACT had only 5 years, again, we think the benefits of chemotherapy are going to be seen early. So any relapses that occur beyond, 5 years or 9 years, that's probably a failure of endocrine therapy, not chemotherapy.